Yesterday, I was talking about attributable risk percentage. How to calculate attributable risk percentage. So, some students get confused in the formula of attributable risk percentage. So, the formula is risk in exposed minus risk is unexposed divided by risk in exposed. So some students keep risk in unexposed in the denominator, but actually in the formula there is risk in exposed. So why we get confused? So if you just memorize the formula and do not understand the definition, then you get confused. So rather than memorizing the formula, let's understand what is attributable risk percentage. If you understand it, you can make your own formula. You don't need formula, right? So attributable risk percentage. So how much percentage you can attribute something as a risk to this disease? So there is some disease, let's talk about common example, lung cancer. So how much you can attribute smoking as a risk factor to lung cancer? How much percentage you can attribute, right, in your study to this risk factor, to this smoking? So that is attributable risk percentage. So we are calculating the attributable risk of that risk factor, right? So we are calculating the attributable risk percentage of the exposure. So exposure is the factor here that we are calculating. That's why we keep exposure in the denominator, risk in the exposure in the denominator. In the numerator we subtract risk in exposed from risk in unexposed, and in the denominator we keep risk in exposed. If you see the formula of relative risk reduction, there we keep control in the denominator, right? So in relative risk reduction, what is the formula? Risk in treatment minus risk in control by risk in control. So there control, we are calculating the difference in risk compared to reference populations. Reference means control. That's why we keep control in the denominator. So this is exactly opposite. If you see attributable risk percentage and relative risk reduction, this is exactly opposite. That's why you get confused in the formula. So that's why I'm telling you or emphasizing that understand the concept rather than memorizing formula, so that you can just plug in number rather than memorizing the formula, right? So relative risk reduction is risk reduction compared to, or the reference is the control. That's why we keep control in the denominator. But attributable risk percentage, so what is attributable risk percentage? You are calculating the percentage that you can attribute to that risk factor, that exposure. So that's why you keep exposure in the denominator.